Okay, and we are recording. Okay, so, oh, Elisa. Well, it said you raised your hand.
No.
Elisa, did you have a question?
No, I was just trying to figure out why my camera is not working.
Let me try something here.
I think it's on my side, my computer.
Okay. Well, we'll get her figured out. See, so down at the bottom of your screen, there's a little video camera. I think yours says start video, the other says stop video.
Yeah, it just pops up saying Zoom is unable to detect a camera.
Oh, well. Well, now that I got nothing. I am the guy that fixes computers with hammers, so.
Yeah, I'll take a look at it when I'm done.
All right, so let's get into the reason you're all here. If I can get this thing to, all right, so I'm gonna share a screen and we're gonna pop into here. I said we're gonna pop into here. All right. And then slide. And okay, everybody got full screen on that one?
Mm-hmm.
All right. So transmission of infectious disease, and I'm going to move this out of the way, hopefully, so I can see things. Okay. Or move it down there. So transmission of infectious disease. Weirdly enough, something we're all becoming pretty familiar with, right? In the land of COVID-19, or more accurately, SARS-CoV-2. So the carrier may not have symptoms yet, but is still able to pass them on. Right? This is how much of the community spread they're believing is happening with the coronavirus. Is we have a lot of people who are asymptomatic but are still infected with the virus and are spreading them in the community, right? So with those modes of transmission, direct or indirect contact. So direct contact, well, okay, thou shalt not lick thy patient. I'm just going to put that out there. We have 4 senses that we use in nursing. We have 5 senses total. You look at your patients, you touch your patients, you listen to your patients, right? You smell your patients. You should never taste your patient, at least not on purpose. Does it happen? Yes, it does happen. I know what human nigu tastes like. Just say when removing a drain from a patient's knee, if you are observing, don't open your mouth to say something as the drain comes out, because those drains are stretchy and they snap like rubber bands, and then they fling human nigu in a about 180-degree arc as it comes out, right across the mouth. So that would have been an example of direct contact. Yum. Indirect contact, what do you think there? Somebody got an idea of indirect contact?
Through the air, like coughing, sneezing.
Okay, right. So you got that airborne contact. What about another form pretty common with indirect contact?
When you like touch like a doorknob or something.
Right, fomites. So they're called fomites, where you've got something on your hands and you touch the bedside table, or you touch the doorknob, or you touch the shopping cart handle, and then the next person comes through and touches the same thing and then touches their mouth. Right, that would be a case of indirect contact. Or you have scabies patient and you are changing their linens without gloves on. You're not in direct contact with that patient, but you pick it up from the linens. Okay, that'd be an indirect. Airborne, well, okay, that's airborne, foodborne, waterborne transmission. Those are kind of self-explanatory, right? You know, through the air, in the food. What comes to mind when we say foodborne transmission?
Food poisoning.
Okay, all right, that's a good one. Here fairly recently, was it Chipotle? Or yeah,
Salmonella.
was that?
E. coli.
Salmonella.
Right,
Or E. coli.
right. Sprouts, can't trust sprouts. And so, and waterborne, now a lot of people think about, you know, Salem's recent, okay, so summer before last with the algae bloom. Now, was that an example of waterborne illness? What do you think?
Yes.
Actually, no, because it wasn't transmitting the bacteria. What was in the water were the toxins released by the dying bacteria. So it was not an illness transmission.
So would that be
but that-
considered a contaminated?
It was a contamination, yes. You know, the problem was the toxins, but it wasn't the algae. The algae itself was not being transmitted from the water into a human host. It was the toxins released by the algae that were affecting, everybody. Vectors. What comes to mind with a vector?
Mosquitoes.
Right, mosquitoes. Then we have things like West Nile, Zika, our old friend malaria. Nope.
Would it still count for like ticks?
As far as like Lyme disease, yes, that's vector-borne
Okay.
illness.
Okay.
Yep. So a vector is something that will transmit disease from a host to another host, and they're biologic. So the mosquitoes, the ticks, raccoons, rabies. There you have a vector. Okay. Contaminated articles, well, that is kind of self-explanatory. How about bloodborne? What comes to mind there?
HIV.
HIV, okay. Hepatitis C.
B.
But there's a whole lot of hepatitises. So what else might you think of with bloodborne? You got anything that just pops right to mind? There's a few of them. There are a
Herpes.
few of them. What was that?
Herpes.
Okay.
That's not actually bloodborne, is it?
It's not actually. It is, however, transmitted from host to host with fluid contact, but not necessarily bloodborne. We're talking bloodborne pathogens. I mean, these are, it has to contain blood. So if a person with HIV sweats on you, you know, even if they sweat into an open wound, that's not going to transmit the disease. But if they were to bleed into an open wound, or you were to jam a needle that had a bore full of that infected person's blood into your finger, sharp safety, really important, then you would have the blood-to-blood contact. Does that make sense?
Yeah.
Okay, come on. There we go. So, chain of infection. And this is one of our big jobs in nursing. One of our big jobs when dealing with infectious diseases is breaking that chain of infection. I am, by the way, trying to keep an eye on time too, so that you guys don't miss Dan's meeting after this. So you got to have an organism to be transmitted. You got to have a reservoir for it to grow. You have to have a way for it to get out of the body. Some form of transmission, be it vector, airborne, droplets, contact, whatever it is. A susceptible host with a portal of entry so that it can enter. All right, this is that chain of infection. What happens if we break the chain anywhere on that, on any of those links of the chain? What happens?
It won't start. It won't infect.
Yeah, you do not have that infection spreading. So in our recent experience, okay, masks, right? Masks being twofold. One, if they're properly fitted, the right mask, it blocks the portal of exit, fingers crossed, happy thoughts, and also blocks the portal of entry, right? The susceptible host. Okay, so how would we break the chain at the susceptible? How have we been breaking the chain at the susceptible host part?
Social distancing.
I'll give you a hint. Starts with a Q.
Quarantine.
Quarantine. That's it. Quarantining those that have it, or this whole social distancing piece, which is why we're having this meeting over Zoom instead of face to face. Bang head on table. But yeah, so if you don't have someone in range to catch the disease, then you've broken the chain at that point, right? And then once you've broken the chain at that point, then you're starting over. So let's say here's Bob. Okay, yeah, but it's not mirrored now, so it's really going to screw with me. So here's Bob, and here is Joey. Okay, Bob and Joey, they're brothers. All right. So Bob gets the Rona. All right. Bob does what he's supposed to, self-quarantines, avoids people, it runs its course, he gets through it, right? Joey over here, he doesn't get the disease transmitted, so we've already broken the chain at the reservoir. Does that make sense?
Mm-hmm.
Right. This is one of the major things, and I wonder what is as nurses, as healthcare professionals, one of the greatest things, the greatest tasks that we can do to break the chain of infection.
Wash our hands.
Wash your nasty booger hooks. Exactly. Wash them. And then of course, don't lick strangers. Always a good plan. Well, you'd think I wouldn't have to say this, but look at the world we live in. That may become an internet challenge at some point, and look how the Tide Pods thing worked out. So, the chain of infection. We can break the chain of infection. We break the chain of infection, there is no more infection. We just have to get everybody to, wear their masks as they should, not stand too close, wash their hands, stay the hell away from people when they're sick. All those silly things that the CDC has been putting out that people are griping about. Well, okay, I do understand, and having been through this whole distance quarantine COVID thing for the last 4 months, even the introverts are going, dude, I need to see some people. But there is a reason for it. My daughter swears up and down, well, used to swear up and down that she's 12, that she's an introvert. Yeah, that ship sailed. So, standard precautions in all nursing care. Standard precautions. It's sort of in the name right there, guys. Standard. You use this with everybody. All right. because we're trying to break that chain. So standard precautions with everybody. I use gloves. I wash my hands. I don't lick my patient. And I wash my hands some more. So we can break that chain with the use of standard precautions. Now that's standard. Everything else, the rest of our precautions, builds on standard precautions. Oddly enough, again, standard. All right. Scrub your hands. Instruments and or dressings that will be going onto a patient. Sterilization. Can you sterilize your hands?
No.
Well, in theory you could, but you wouldn't have hands anymore. Because what does the process of sterilization do?
Burns the germs. It kills everything.
It kills all living tissue. That's a whole lot of living tissue. So you can sanitize your hands, but you can't sterilize your hands. So when we're doing things like that, when we're doing procedures that require sterile procedure, we use sterile gloves and sterile procedure. Disinfection. So sanitization, disinfection, sterilization. 3 layers coming up there, right? Why moisture-proof bags for contaminated articles? What do you think?
So none of the contamination leaks out of the bag.
Right. If it can, if the water can get through, if the moisture can get through, the bacteria can come along with it. And then instead of having all of that nicely contained inside one bag, now it's on the outside of the bag to rub onto things and personnel and all that in the outside world. Okay. If the sterile package has become wet, again, if water has made it through, then the bacteria can make it through afterwards. Broken seal, that means that that's been opened. It is no longer sterile. Now, not all dressing changes, not all wound care is sterile, but it should be, from my personal opinion, anytime you are doing wound care on an open wound, you need to be using sterile procedure to keep the bacteria out, right? And then very last, using PPE as needed and available. Never thought that would be that would be a caveat I would have to add, but again, Corona land, using the personal protective equipment, that is not just protection for your patient. That is protection for you. So we'll hit this little piece. Why does the nurse need to be protected? Somebody
Because
give me a
you're
reason.
going and
What's
because
that?
you're going and you're touching other patients as well.
Okay. All right. So if you get sick, you're going to spread it to others, right? Okay. Why else?
If you're sick, how are you supposed to help others?
Okay. We're on the right track there. So here is the thing. When you graduate and you get your shiny little pins and those lovely letters after your name that say, I am now a nurse, okay? You are not just taking care of one person.
Taking care of multiple.
You're taking care of multiple people. You have a skill set. This down here, because I talk with my hands a lot. You have a skill set, guys, that the rest of the population doesn't have unless they happen to be nurses, right? You have a skill set that is very valuable. One of you can care for 18, 30 other people during a week. One of them can care for half the time, not even themselves. Does that make sense?
Yes.
Your skill set is valuable. That's why we're, running you through nursing school at high speed and and you know, building up all the stress. Your skill set is valuable. It is needed, and you do things, you know things, or you will know things that the general population does not. So the PPE for protection for the nursing staff, and we do tend to be martyrs. Okay, we tend, or maybe martyrs is not not the exact right word, but we have a tendency as nurses to go full speed ahead, and you know, because we have people to take care of, and we don't do a lot of self-care on ourselves. At the start of COVID, there were some lovely memes going around, which were, you know, funny and yet very accurate and somewhat sad. Is, you know, the rest of the world is running screaming for cover in quarantine, and nurses are like, all right, so I need some paper towels, some plastic bags, duct tape. All right, bitches, we ride at dawn. That's kind of our mindset, because we take care of people. So in this case, personal protective equipment, protect yourselves, do the self-care part, but protect yourselves because you're valuable. You know, I would say that you can't place a greater value on any one life over another, but in some cases, guys, yes, you can. You know, and it's good, and it's for the good of society themselves, or itself. I should, not themselves. The good of society itself is, you're a nurse. You are needed. Okay, so at the portal of entry, why clean and dry skin?
Because most bacteria and infections need moist.
Okay,
to
that's,
survive.
I'll go with that. Why else clean and dry? Actually,
So you don't get ulcers.
Don't get ulcers, okay, because skin that is consistently wet, right, has a tendency to break down. That tissue becomes weaker, right? It has a tendency to break down, and when skin breaks down, you have a portal of entry. When we go into the integumentary system, okay, that, I just had something flag up here. What is? Oh, all right. So the integumentary system. All right, I don't know what just happened with my computer. That is your barrier, because we live in a world, in an environment. We are one organism. We are surrounded by trillions at any one moment, trillions of microorganisms, and they all want to get into us. Why do they want to get into us?
It's how they
Because,
survive.
huh?
How they survive.
Right, we're made of meat, guys. We are made of meat, and bacteria love meat, so they want to get inside. Skin clean and dry keeps that barrier out, or keeps that barrier up, keeps the worm and juicy stuff inside, and the things that want to eat the worm and juicy stuff outside. Yes, I do tend to use a bit of humor in these because it helps it stick. I bet none of you ever thought at this point about the idea that, yes, I am made of meat, but you are. You know, certain cannibals call us long pig, whatever. So, clipping the client's nails, especially diabetics in the feet. We will cover this more in depth in Nursing 203. But clipping the client's nails, because that is a place where you can break the skin while clipping, or when they chew their fingernails or cuticles, and then it opens up a portal for infection. Avoid positioning clients against objects that could cause skin breaks. Gee, I wonder why that is. Again, trying to maintain those barriers. We have the non-specific defenses against infection, and skin and mucous membranes, intact skin and mucous membranes are big parts of that. Repositioning clients, why do we reposition?
To prevent
Avoid bed sores.
Right? Or pressure-related injuries. Yeah, the terminology keeps changing. Was bed sores, then it was decubitus ulcers, and it was pressure injuries, and now it's pressure-related injuries was the last class that I took. It's the same thing. It's just the name was changed to justify someone's PhD. Well, okay, so they're not always due to laying in bed. If a patient is in a chair, they can have breakdown. Right? And then clean, dry, wrinkle-free. It's Thursday. I'm losing my R's and sometimes my L's. Wrinkle-free linens. Again, same thing. It's clean, it's dry, prevents breakdown. Come on. Tick me off, computer. There we go. So, and now urine collection bags lower than the client. Why is that?
You want backflow.
Yeah, you don't want the bacteria backflowing up into the bladder, and a patient who has a catheter, which is already a big risk for UTI. If that flows back in, say there's some bacteria growing in the bag. Now it backflows into the patient, and then we have UTI. Urinary tract infection, for those who are not familiar with the term.
So I have a quick question.
Yes.
For like the condom catheters,
Mm-hmm.
I have a patient who has one, and so I'm just out of curiosity. So when urine is sitting in the actual condom part, can they still get a UTI because it's not directly inside the bladder, but
It's a it is a little bit of an increased risk, but it is less so because there are multiple sphincters and a longer urethra for the bacteria to travel. Does that make sense?
that does. Thank you.
Okay. Draining wounds and skin breaks. Okay, because you got the skin breaks, you've got your portal of entry, but a draining wound. All right, so if it's draining, there is an opening in the skin, and that's portal of entry. But guess what? It's also portal of exit if that draining wound happens to be infected. And then sterile technique for invasive procedures. Invasive procedures is putting anything into the body that's not supposed to be there, right? Doing placement of IV lines, doing trach suctioning. The one procedure that you're going to get into that you'd think, well, that should be sterile, the nasogastric tube, is actually a clean procedure. But then it goes into, where is that tube going? NG tube, I see that look, Stephanie. NG tube is a clean procedure because you think about it, your GI tract, your respiratory tract is hopefully a sterile environment. Your urinary tract is hopefully a sterile environment. Your GI tract is full of bacteria. Does that make sense? Okay, patient teaching. But I'm a nurse, I'm not a teacher. Oh, yes, you are. The biggest piece here is if you have an interaction with a patient and you do not perform any patient teaching during that interaction, you have missed a golden opportunity to make a change for that patient. Every time you're interacting with that patient, you should be teaching them, educating them on something. And there's a reason that nurses do this, because physicians kind of suck at doing this, the bedside teaching. This is one of the things that we do. So patient teaching, hand washing technique, personal hygiene practices, Aseptic technique, which is different than sterile technique, right? Aseptic technique for self-care. Think if they have to give themselves injections, that would be teaching them aseptic technique to do that. How to handle contaminated materials. All of these pieces, you don't come out of the womb knowing how to do this. If you haven't had this training, say, I don't know, in nursing school, you don't know how to do this. So we teach them how to do these things. Hygienic practices. You might be surprised at the number of times that in my career I have had to re-educate a female client that it is not back to front.
Exercise.
Not back to front. It's front to back when cleaning peri. It's kind of surprising, but then it explained all the UTIs. Food handling, preparation, and storage. Right, proper methods there to avoid foodborne illnesses. And the one that we really all kind of suck on, adequate fluid intake. In my position here, I see a lot of urine because we do the preclinical drug screens, and I see a lot of urine, and I would say probably 80% of my students are dehydrated on a regular basis. It's a thing that is. Dark urine, pretty good sign that you need to push some more water. Food intake, adequate food intake. And we'll actually, in Nursing 201, we're going to go, we'll go deeper into that, or you and Karen will go deeper into that as far as what malnutrition is, and a patient who eats 5 meals a day can still be malnourished. Right? And then special procedures directly related to their self-care. Okay. So that's a whole lot of teaching that we do on a regular basis, daily. It will become second nature. All right, hand washing. We're gonna roll through this fairly quickly, but we'll hit the high points here. When do we hand wash? When do we wash versus using a hand sanitizer like alcohol gel? Wash when they're visibly soiled. Before and after client contacts. Right? After contact with a source of microorganisms, and if you reach in to take care of your patient and you find something wet that's not yours, you've just been exposed to microorganisms. And patients do have a tendency to hide things that are wet and not yours. It happens. You're like, oh dear. Before and after doing invasive procedures, all right? Before, to prevent transmission to the patient, and then after, just in case you got something wet and not yours and didn't realize it. And this is one that is part of the CDC guidelines. I rarely see it. Washing before removing the gloves if they're visibly soiled, and then washing again after removing the gloves.
Yeah,
That's a CDC guideline. What's that?
That threw me off.
Yeah. I have only seen it a couple of times, and well, there was a lot of poo. But generally in practice, people are removing gloves and then washing their hands. The guideline is from the CDC, before removing the gloves if they're really soiled. Hand sanitization. If you didn't touch something wet and not yours, and there's no visible nastiness on your hands, then the hand sanitizer, I'm gesturing to a bottle that you can't see off to my left here. The hand sanitizer is adequate, although it should be, at the absolute minimum for your day, absolute minimum, You start off with a really good hand scrub and you end the day with a really good hand scrub. All right, that's it. That's if you're not actually touching people. Does that make sense? All right, long wash. All right, that's the one. Good scrub. I mean, your happy birthday to me, happy birthday to me, happy birthday. Oh crap, what were the words? Happy birthday to me, right? So really good long scrub. Short wash in between. So this is reducing the bacteria that are resident on the skin, right? Protecting in case there are any open wounds. And how do nurses find paper cuts?
When they use hand sanitizer.
Right, alcohol gel. It's like, okay, oh, there it is. Yep, we find little wounds on ourselves that we didn't know were there all the time. All right. And these PowerPoints, by the way, this is the chapter 40, 41, 42 that is posted in both week 1 and week 2 in the supplement. All right, antimicrobials, disinfectants, antiseptics. Again, we're decreasing the number of pathogens, but we're not completely eliminating, right? We're not sterilizing, but the antimicrobials will knock those levels down. Achoo, achoo. Don't leave the biohazards on the counter or on the bedside table or on the floor for the next person to step in or put their hands in. Clean up waste right away and do it properly. Do not dispose of needles in the trash can. You will get screamed at by housekeeping and then by your manager and your coworkers. Sharps go in sharps containers. That's a proper disposal. Right? And this last piece, you may hear me snark from time to time about, how I have all this education, but I'm not qualified to run a mop. So Salem Health, as a nurse, I cannot clean up a regular spill in a room. I have to call environmental services because I am not qualified to run a mop at Salem Hospital. Seems silly at first, but it does make sense because they are specialists. They have been trained in the proper ways to do this and how to use the chemicals safely that they use in cleaning up these spills. But I'm still a little bitter. Okay, so we got a biohazard, all right? If it's sharp and pokey, this is the piece I want you to take from this, okay? If it is sharp and pokey, it goes in the sharps container, right? Blood tubes, syringes, catheters, IVs, all these other pieces would go in a red bin, which is different than the sharps container, right? If you're doing finger sticks, trust me, your managers will love you if you cease putting the cotton balls in the sharps container, because those are not cheap to get rid of, and cotton balls fill them up faster than needles do. But again, follow the protocol of the place you're working. But yeah, and if the protocol doesn't specify it, here's the bottom line: if it's sharp and pokey, it goes in the sharps container, because we want to break that chain of infection, right? And get along with our coworkers. All right, so let's get into modes of transmission here. You know what? We're going to make this. So contact transmission, weirdly enough, direct contact, okay, or indirect contact, but it requires contact. So GI respiratory diseases, because we're finding with the coronavirus that it's not just droplets in the air or airborne particles, it's also things on surfaces, people touch their faces, okay? So for contact, we use barriers, gloves, goggles, gowns, masks, right? So gloves. This is the understatement of the show here, guys. The most commonly used protective item, right? Part of standard precautions. Most commonly used protective item, we use them by the truckload, and we should be using them by the truckload. If you have a latex allergy, and this is becoming less common, not the latex allergy, but the concern, it is becoming less common as we move away from latex-containing products. Right? There are still some things in nursing, and you need to know, or in healthcare, I should say, and you need to know what they are if you have a latex allergy, or if you're caring for people who have a latex allergy, or if you're caring for people who might have a latex allergy, which breaks it all down to knowing what contains latex, right? And then someone with a severe allergy should have epi available, because anaphylaxis is absolutely no fun. Masks, all right. Eye protection, gowns and aprons. Note they say fluid resistant because sometimes the fluids find their way in, unless you're wearing like a level 4 bunny suit, and then you might. PPE removed in the correct sequence. Go with what the book says for testing. All right. So transmission-based precautions. The transmission-based precautions all start with what? Starts with an S. Ends with standard. Standard precautions. It all starts with standard precautions, right? And then you move up from there. So universal precautions, body substance isolation. Okay, the last piece here, standard precautions are used by all nurses when caring for all clients, hence the name standard, right?
Yep.
So I'll go past this. You can review those later. So for contact, standard precautions, weird. Use your PPE, weird. If you can, avoid transporting the client, because whenever you move them out of that room, there's a chance for shedding of the infection and spreading of the infection. Clean the equipment, weird that. So assessment tools, what might I be talking about with assessment tools? Stethoscope, blood pressure cuff, maybe the pulse oximeter, any of these pieces for that patient, and they don't come out of the room until that patient is healed, fixed, transferred, whatever, and then before they come out of the room, they get a deep, clean disinfection, right? And then terminal disinfection, there are multiple ways to do this. We just had a company come through and fog the school in preparation for returning, or that was what was supposed to happen last Sunday. But also the use of ultraviolet light. Get on my little soapbox here a little bit. So for those of you that tan under a desk lamp, and you know who you are, ultraviolet light, sunlight, not your friend. But as far as killing off bacteria, sunlight's great. And no tanning beds. Tanning bed's bad. All right. I try to provide you with as much experience as I can as we go through this. All right, so, and then contact, door may be open or closed because it's not an airborne transmission, it's a contact transmission. All right, droplets. Right, so you got little tiny mist. If anybody ever watched Mythbusters when they did the how far can a sneeze travel? Oh, that's a gorgeous one. If you haven't seen it, you need to watch it. And then you want to hide from people like forever. But droplet transmission, so the droplets blasted through the air, get in to the mucous membranes, eyes, nose, and or mouth, right? So what do you think with droplet transmission? Ah, dang it. Well, okay, I telegraphed that one. So standard precautions, weird. Mask when entering the room, but especially within 3 feet. Now with Corona, we hold for 6 feet, but yeah, within 3 feet. If the client has to go anywhere, they get masked. Again, for the same reason, to try to block at the portal of exit, right? Because for droplet precautions, it's more than likely going to be something respiratory blown out. Door may be open or closed. Why? Why do you think?
Because if you're within 3 feet or.
Right. I mean, the droplet, the length of, or the distance those droplets will travel in your average room isn't going to make it out the door. Unless it's a really tiny room, then you might want to close the door. Airborne. Woo-ha. All right. So with tuberculosis, measles, chickenpox, SARS, smallpox, all right. So what do you think it's going to start with?
Standard precautions.
Standard precautions. Yay. They get to stay in their own room, wearing masks. And these are not surgical masks. We're talking N95 or a PAPR hood. Because the N95 masks don't fit everybody. Right? They don't fit everybody. Myself, I had to wear a PAPR hood because thanks Grandpa for the nose. It did not fit the standard N95 masks. So it's a hood that goes over, has a belt pack with the N95 filtration and a fan which provides positive pressure. So filtered air was constantly being blown in and then out the bottom of the mask. Right? That's a PAPR hood. Client wears a mask and the client wears an N95 mask. They're being transported. And then the door has to be closed, right? Because it's not a, oh, we're getting there. It's not a case of, this is not going to make it that far out. It is airborne transmission. It's going to make it out in the hallway. So with isolations, based on the diagnosis, right? Let's skip through this because I want to get to, so you got standard precautions, transmission-based precautions. All right, we've just talked about those. Setting up isolation. I want to hit the high points on this, and we're almost out of time. Standard precautions, and you'll want to review this. Most of this is pretty self-explanatory, really. And transporting protective. Okay, this is a piece I wanted to get to. Protective isolation. So, when might a patient require protective isolation?
Chemotherapy.
Chemotherapy, or perhaps radiation as well, if their immune system has been compromised. In this case, we're not protecting everybody else from this patient. We're protecting this patient from everybody else. Make sense?
Mm-hmm.
Oh, I got one more. Well, better late than never. So those entering, mask, practice hand washing, reaching that point because we are protecting that patient. Right? And whoop. No fresh fruit, fresh veggies, or flowers. Why is that?
Contaminants.
Right, bacteria. Right. Everything's got to be cooked. Rectal temps, enemas. So IV and IM injections, if we can avoid them, right, we do. So why rectal temperatures, enemas, or suppositories? Why would that be like first on the list, do you think?
Port of entry.
Okay. And why would it be more of a risk than an oral, say an oral temperature?
Because the rectum is used to pushing things out.
And there's a heavy bacteria load there. Now there is an oral bacteria load too, but the membranes, you got a little bit more room. The mucous membranes are less likely to be damaged, whereas rectally, you can damage those mucous membranes, and then you've got a heavy bacteria load that is coming right by your damaged spot, right? Best is the forehead or ear probes for monitoring temperature, because you're not going to damage skin or mucous membranes using those, hopefully. All right, that, holy smokes. All right, I ran a minute over. My apologies to Dan. And I'm going to now stop this share. And I'm going to release you to go hit Dan's Zoom meeting.
I have a
And,
quick
let me,
question.
yes,
Our quiz next week,
yes.
since we're on campus on Thursday, is that going to be on campus or is that still going to be online?
It opens Wednesday and closes Thursday morning.
Okay.
So yeah, it's on Socrative.
Okay, perfect. Thank you.
Let's see. And okay. All right. Nursing 104 class at 12. Yes, sir. So what I'm going to do here is wave bye-bye to y'all, and this will be posted in a little bit on YouTube. I will put the link in the e-supplement.
Perfect.
Bye.
Thank you.
Thank you.